do easy little things and just give back to the community that we were in. We also were there over the Easter holiday, which was really, really exciting for us because we got a chance to be immersed in the culture. We had 2 drivers during our trip who became really good friends and guardians for us, and they invited us back to their home for the Easter holiday. So we got to actually sit with their families, eat their food, listen to their music, and really be immersed in the actual culture of Ethiopia. So not only did we just see things in the clinic, but we actually felt like we were a part of their community. Right, now I want to talk a little bit about the second part of our trip, which was charity and social justice. And so here we got a chance to meet with 3 different, really unique individuals. The first one up here is Dr. Holtz, and what he does is he works for the Mother Teresa Orphanage or Community Center, and he works helping children who are very poor get surgeries on spinal issues and cancer. Then we have down here Dr. Hamlin, and she is going to be talked about more by Kelly, and she runs the Fistula Hospital. And we're also going to show you a short clip from her documentary. And then in the right corner is Marta and Demi, and they are the founders of Project Mercy. And what is so unique about them is that they go into rural Ethiopia, they ask the people what it is they can do for their community, and then they try to help that community build those needs. So they do clean water, education, and healthcare. So the idea that some lives matter less is the root of all that is wrong with the world. So it is easy to sit here and become complacent either because you don't think you can make a difference or because the people seem far removed from the injustices and they don't seem real or changeable. But in fact, we were reminded that one person with a passion can make a difference. And using the talents we have, which in our case is physical therapy and nursing, we are able to meet the needs. Disability is a huge problem in Ethiopia, and it's something that the people are very aware of and that they want to change. We felt lucky to be able to collaborate with the Ethiopian PTs and use our skills to help support the physical therapy and nursing programs to develop and improve, allowing more individuals in Ethiopia to get care. This experience left us with the challenge and the calling to meet the needs of humankind, be it in Denver, in Colorado, in the United States, or around the world. We are not asking why we have the privilege to be born where we are, but we are recognizing the fact that we are privileged and that we need to go out and share our privileges with the people less fortunate. So now I'm going to show you a short clip of A Walk to Beautiful. And the reason we have this in our presentation is because we found that this was a very inspiring experience, and also because it gives you a chance to actually see a little bit of the people and their culture. and talk to you a little bit from the nurse practitioner perspective.
Hello, I'm Kelly Kramer, nurse practitioner student. Kim and I arrived in Addis Ababa 2 weeks after the PT students had finished their clinical rotations. So we got to come in and kind of go with them on a few different experiences. We got to go to the Fistula Hospital, and we got to go to Project Mercy, and we also got to go to the Mother Teresa Hospital. And basically, from a nurse practitioner student perspective, kind of just shows you the differences in healthcare in general, just how different their healthcare is there from what we have here, just with tests and diagnostics and lab work and assessment skills and tools, just from a multitude of different areas. And basically, for bringing back into my practice, what I would take is that you have to address people from their culture, from their way of life, and ultimately from their health goals, because the goals that people have in Ethiopia are a little bit different than here in the United States. And things that were inspirational to me were just being able to meet people like Dr. Catherine Hamlin and also Dr. William Gordon, who's pictured here. So before Dr. Hamlin opened up the Fistula Hospital, there was no care for anyone in the country for fistula care. And basically, she's made awareness about this entire issue. So because of young marriage, sexual abuse, and improper birthing and prenatal care, many women have these fistulas. And they're, prior to getting care, they were just kind of sitting at home, secluded, and weren't able to participate in their everyday lives and kind of go on with their lives once they had this condition. But because of her hospitals, there's a much bigger awareness now, and a lot of women are being treated, and that's great. And a new program that Dr. William Gordon has set up is he sends women out into the community, and he'll pay them to teach women about fistulas to kind of decrease the taboo surrounding this this problem, and kind of bring women back in to get treated and show them that they're not the only people who are dealing with this. So that's a really great program that he's setting up, and they're just bringing far more women in to get treated. And on a greater level, just meeting people like this shows you that, just these two people can have a major impact and can, change the entire, healthcare for women in this one country. So it's great. They're also setting up a midwifery program in Ethiopia, so that's something for the future, I think, for us to kind of be involved in, and that would be great to kind of learn more about that. And then also just about educating the population and kind of making awareness and showing women that they can be treated for this condition. So the next part of our trip, Kim and I were able to work with some of the general practitioners at the Glenn C. Olson Memorial Primary General Hospital in Yedabaugh. And it seems like here they've just set up a great system of just educating people about how to take care of themselves, how to look for clean food and water, and just basically the teaching component of this is really inspirational to me. The healthcare system here is attempting to overcome many healthcare disparities that are created because of social and environmental factors. A multitude of teaching is done around housing, vector-borne diseases, solid and liquid waste, waterborne diseases, communicable diseases, and malaria, which are all epidemic in this population. Also, direct programs have been set up to teach the population about environmental health, personal hygiene, HIV/AIDS, housing, disease control, and the use of antenatal care and communicable disease prevention. So just seeing the patients come into the hospital and seeing how much they actually know, that was really